Hey guys, so this is long overdue, but this is how I'm gonna do it. So I want to tell you guys about my third year so far. I have 2 rotations left, so this will cover my experience until that point. My last 2 rotations, maybe y'all will see something different for, we'll see. But I hope you guys enjoy this video of me revisiting my third year. Third year is so different. But don't forget, before we get started, y'all can go back and watch first and second year. Y'all can like, share, comment, and subscribe. My third year began with general surgery. For my school, we do an 8-week rotation in general surgery where we are pretty much able to shadow, but also as a medical student, you are able to typically do more. I spent my 8-week rotation with one physician. He went to 3 different hospitals and had 2 different clinics that he operated and practiced out of. So if that doesn't sound like a lot already, let me tell you, it was a lot. I had 5 different places to go every single week. We did surgeries. I feel like our most common surgery was cholecystectomy, which is the removal of the gallbladder. We also had 1 trauma case, which was ironic. I didn't have a lot of trauma, only 1 trauma case, and a few other surgeries like appendices, a lot of your common surgeries, but I did not, I was able to assist in something that I probably shouldn't talk about on here. It's a little gross, but I was actually very hands-on with my preceptor as far as in the operating room. He let me really help do a lot. I helped hold a camera during the laparoscopic procedures, which is a camera that you stick in a certain hole that the surgeon creates so you can see without having to cut a line and open people up. During clinic days, I was able to just see him see patients. Wound care days, which is another type of clinic, and I guess that's really like a 6th place we went, because we did go to the wound care area in a long-term care facility, but it was still within the same hospital, so I guess I shouldn't count it. But anyways, we did wound care, and that was, oh my gosh, y'all, it was rough on my nose. Whew. I was just like, my eyes would be watering. My nose would be like trying to drip. Eventually I got to where I could just wear a mask, thank God, but it was interesting. I learned a lot though. I definitely feel like I gained a lot of practice and experience in that area, and I was able to work with a team of wonderful, wonderful ladies. I loved his staff. They were so fun to work with. The OR was pretty cool. Most places, actually. I was able to talk to like some of the OR techs, and I enjoyed that. Surgery is not anywhere on my radar. Still isn't. It wasn't before, but it still isn't. But I am grateful for the opportunity. I always went in open. That's when they recommend. In third year, you just go in everything open. Even though my mind is kind of made up, and I can tell y'all that. But anyways, it was interesting. So that was 8 weeks of my life. It was a long 8 weeks. I was exhausted at the end. I did have 1 week where my preceptor was on vacation, so I went to work with a different preceptor, and it was a lady surgeon, so it was cool to get to see her practice, and I did learn a lot with her. She actually she spent a lot of time like talking to us and helping us, but I did not get to be as hands-on. So in clinical rotations, you can have surgeons or even just physicians in general that are very like, hey, you go do this, I'll check on you, or some that are kind of like, just watch me do this. So everybody's experience is a little different, and I was able to have a blended experience, which was really cool. But some of the coolest procedures, I also saw a muscle and nerve biopsy, as well as a laparoscopic mesh procedure where the person had a hernia in their abdomen, and we were able to put a mesh in. Procedure where the person had a hernia in their abdomen, and we were able to put a mesh in. So I log all of these experiences. We have a requirement of 150 logs. So we don't put anything breaking HIPAA on the patients, but we just put what we did, what we learned, what we saw, etc. in our online website where we log all these things. So I had 150 required for this rotation, and I have all those typed up. And then at the end, I received an evaluation from the preceptor. And then on the Friday of your last week, you take an exam And our exams are called COMET exams. They're administered by the MBO and me. I won't go into all the acronyms right now. They'll be in the description. But it's basically a shelf exam for allopathic students, but we just are tested on everything or anything they want to ask us about general surgery. That test was Anyways, so it was interesting, but that's over and done with. And it also is standardized, so it's more so like our board exam, which is helpful. And that was my first one that I ever took for like a clinical rotation. So after surgery, now we can talk about my next rotation. Last day of surgery. I'm making this walk because it's over here. Okay, so following my surgery rotation, I did 4 weeks of pediatrics in an outpatient setting. So I was only in a clinic. I was actually at a community health center, which is like my dream. That is my career goal, to establish one of those one day. But anyways, I worked with one physician and we saw pediatrics. So that's from 0, basically once they leave the hospital, until 18. So that was a great experience for me, just being in that environment. I was able to change cities for that rotation from my surgery. I did my surgery in a larger, more metro area, and then I did pediatrics in a smaller area, and I really truly enjoyed all the connections I made with those patients. I honestly, for me, pediatrics is like a heart-wrencher. Like, I don't want to see sick children, but honestly, there weren't so many severely sick children since it was outpatient. So of course we had a lot of cases of things like ear infections and asthma and allergies, as well as things like ADHD and behavioral problems. So those things really sat on my heart. I know I can still remember a few patients that had a lot of trouble, had difficulties emotionally and, things like that. And those people really stuck out to me. And I really enjoyed my experience there. He gave me a lot more freedom to see patients on my own. He would, of course, go back in the room with me after I saw them, but I got a lot of experience in interviewing, doing my physical exam, which was, it was so helpful to be able to do that like all day, every day for like 4 weeks. I was in a slower season, so I didn't see like a gazillion kids, but I did meet my requirements easily of the 75 case logs. So I did log a lot of my interesting cases and things like that to make sure. I believe I was on this rotation around Thanksgiving, so we did get, I think, a break for that. The clinic was closed on Thanksgiving, so that was nice. But it was a very diverse, like, full-size clinic. The clinic also had family medicine, women's health, dental office, as well as an x-ray technician with an x-ray machine in office. So it was really a great experience. I was able to, see kids for injuries or, rashes, all those types of things. Rashes are my thing, though, that I really need to get in my brain. Y'all pray for me in rashes. But anyways, it was really cool to be able to, like, see if somebody, like, injured themselves and then go to the x-ray. Like, I didn't have to go to the hospital or wait for the hospital. So it was really good. I learned a lot about managing very, very common things. So I enjoyed pediatrics. No, I don't think I'll be a pediatrician either, but it's going to be a part of what I think I plan to do. So yeah, that was my pediatrics rotation. It was awesome. I loved it. It was a set schedule, which was really nice. And yeah. Okay, so also, though, I think I didn't mention this yet, the pediatrics rotation had a comment at the end as well, just everything pediatrics, and that's why I mentioned those rashes earlier, because, baby, those questions on those rashes, I think they got me, but it's okay. Test went fine overall. Evaluation went well. He did have some good feedback for me, which I really appreciated. And he gave me a lot of opportunities to present patients, which is something that's commonly done as a medical student, where you go see the patient and then you tell the doctor about, who they are, what's going on, what do you think is going on, and what do you think needs to be done. So that's really cool. And that was like a really great part of that rotation as well. I gained so much experience. Like, honestly, if I could go back, I would. So let's go on to the next rotation. Y'all get it? Rotation. So after pediatrics, I had OBGYN, which is obstetrics and gynecology. So that is women's health as well as pregnancies and things like that. So they are able to perform surgery as well as have a very strong clinic life. So for people that really like the best of both worlds, it's an area that's pretty high up on their list. I had a wonderful preceptor. I loved her, and she was also an osteopathic physician, so it was awesome to be able to work alongside someone that trained to get the same degree that I'm working towards. So she allowed me to see all of her patients with her. I helped deliver, we had mostly C-sections. So we had about 3 of those, like in one day, one time. It was really cool. And then didn't have as many vaginal. I think my entire 4-week rotation, I only had 2 or 3 vaginal deliveries, but I did get to see a lot of C-sections, and I absolutely fell in love with delivering babies. I did not know how amazing like it would feel. And I also really enjoyed like clinic. I enjoyed seeing like all the ladies that were expecting, and I loved it. I mean, I did not get to see many like gynecological procedures just due to the time I did it. I participated in this during the month of January. So that's kind of like, beginning of the year, most people aren't having procedures done due to insurance reasons and things like that. So I did not get to see many other procedures, but back in high school, I was able to work with an OB-GYN, and I did see several then. So that was kind of like, it's okay. But I really truly enjoyed the obstetrics part. I loved the delivering babies. I loved seeing the pregnant ladies and, all those things. And I also just loved the women's health aspect of it all. It was very interesting. It was nice to see like families as well as, mothers that, were single. And I think I learned so much on that rotation. That COMET, I did really well on that COMET for me. I was so grateful that I learned so much, and I had like time to study. It was a good work-life balance. She was very understanding of me still being in school, like, studying every day, not just only going to rotation. So that really helped. And so the COMET went well, evaluation went well, and I just loved my obstetrics and gynecology rotation. So let's talk about my psychiatry rotation. That was during the months of like January, February, give or take, I think. Yes. So anyways, it hasn't been that long, but I had so much independence. I loved every moment of it. It literally made me consider this so much more heavily. I did outpatient only, so I saw patients that were admitted to a psychiatric unit of a hospital. It definitely was an emotional toll on me, being the empathetic person I am. I really feel for people, and I had to truly like pray for my peace and, my mental health and things like that during this rotation. But it was such a blessing to be able to encounter these people that, have these different struggles and these different mental illnesses, and just truly walk with them and help them as best as I could. Medications are used, so I did not manage them medication-wise. Of course, the doctor did that, but she gave me a lot of freedom to be able to see the patients and document that information about what I've seen and kind of work with her as she helps treat the patient. So it would be kind of good. I would be able to see the patient in the morning. She would visit with them in the evening so we could see the changes throughout the day and things like that. So this rotation taught me a lot of independence. It was very, very, very powerful for me though. I did see a lot of patients with things like schizophrenia, bipolar disorder, depression, things like that. So, those things are heavy, and honestly, it does break my heart a lot just to think about, like mental illness, like your mind, we can deal with like physical ailments, but, not really having peace of mind or just kind of having like being in control of that, it can be very difficult. It is very difficult, I know. And I don't know, I really had to separate, myself. Like when I got home, I had to make sure I was able to clear my mind and my thoughts so I could study and make sure I did well on my exam and things like that. But overall, it was a wonderful experience. Definitely heavy, but a wonderful experience. I did well on that comet as well at the end, but I am still waiting for my evaluation from that rotation. It's a little delayed, but as y'all know, there's a lot going on. So yeah, that was my psychiatry rotation. Okay, next we're going to talk about my emergency medicine rotation. I really was a little nervous about it. I was probably most nervous about this one because I did not want to end up in like a code and then I'm sitting there like stuck. I didn't want to be the person that was like, I don't know what to do. But of course, as a medical student, I'm with a doctor. They know what to do. I have someone showing me and helping me, and there's nurses and plenty of people around to help me. So I actually really enjoyed that rotation. I really learned a lot. I was able to get some practice in myself, seeing patients and things like that in the emergency setting, but as well be able to see how other people practice. I really liked the environment. You were kind of free to see whoever, go wherever. There were some interesting things. Like, if anything, it was the most interesting rotation. I won't go into too much detail just to not disclose too much information, but it was interesting. So I enjoyed it though. Overall, I learned a lot, but sadly it was cut short due to the crisis that we're having in the country, or had, depending on when this video comes out. So I really enjoyed my preceptor. I did enjoy my experience, and I was able to assist in things like placing the central line, which was really cool, as well as I sutured an eyebrow. Never done that in my life. I've sutured on like sleep people after surgery and things like that, but I just really hope her face looks similar after. But I had an awesome time, and we're required to do that for 4 weeks, take the test at the end like the other rotations, as well as log 75 patients.